Hello friends, myself Professor Sanjay Purohit. I would like to extend a warm welcome to you on my YouTube channel. I would like to thank everyone who has subscribed my channel and encourage you to do so if you have not already subscribed it. Please subscribe it so that you will get a new video notification earliest. Friends, today we are going to talk about tube cystotomy in bug. In the clinical series, this is my second lecture. Tube cystotomy. Tube cystotomy is urethral bypass surgery or urinary diversion technique using Foley's catheter. This is performed in case of obstructive urolithiasis. In the tube cystotomy, a Foley's catheter is placed through a separate strap incision in the abdominal wall. This catheter is inserted into the urinary bladder and urine is bypassed. So this is known as urinary diversion technique, and the natural passage of the urine is bypassed by the Foley's catheter. So this is also known as urethral bypass surgery. Obstructive urolithiasis is most common urinary tract disease. Successful resolution of obstructive urolithiasis depends upon early diagnosis and treatment before the complications such as urethral necrosis or rupture, urinary bladder rupture, or hydronephrosis occurs. Obstructive urolithiasis commonly observed in male due to their unique anatomy, rarely in the females. This one is sigmoid flexure. This one urethral process. These two sites are common for the obstructive urolithiasis in bucks. Obstructive urolithiasis is common in castrated animals, even more common in the males that are castrated at early age, because the urethral development depends on testosterone hormone. Therefore, if the source of the testosterone, that are the testes, is removed before the urethra has matured, the urethral diameter will not fully develop. So, the incidences of the obstructive urolithiasis are more in castrated animals in comparison to intact one. Predisposing factors. Predisposing factors are broadly divided into two categories: dietary predisposing factors and non-dietary predisposing factors. Dietary predisposing factors depends on the diet of the animals. Diets high in calcium, magnesium, phosphorus results in altered calcium phosphorus ratio that can result in stone formation. high estrogen intake, particularly the lucens that have high estrogens. Second one is high oxalates. The high oxalate rich plants are also predispose the calculi formation. Diet deficit in vitamin A, lower water consumption or high loss of the water are also predisposed for deposition of the calculi. Now we discuss about non-dietary predisposing factors. The first one is castration at early age, increased urine concentration, urine stasis, increased urine pH, increased mineral excretion, desquamated epithelial cells, urinary tract infection, increased urinary mucoprotein. Factor that predispose to an alkaline urine pH are herbivore diets that are high in protein, and urinary tract infection. Common site of obstructions. Most common site of obstructive urolithiasis in bucks is urethral process. Second one, most common site is sigmoid flexure. This is first most common site. Second most common site is distal sigmoid flexus. Other one is neck of the unibladder, urethra, and kidney. The obstructive urolithiasis may block at multiple sites or may present the entire length of the urethra as sandy or pasty type of the deposits. Type of obstructions. There are two types of the obstruction: partial obstructions or there may be complete obstructions. In case of the complete obstructions, if the cases are not treated on the times, there may be rupture of the urethra or rupture of the urinary bladders occurs. History: dribbling or not passing the urine, pain, inappetence to anorexia, depression, weakness, restlessness, bruxism, that is teeth grinding, straining and stretching out, and vocalization. Clinical examination. Clinical sign depends on duration of the obstruction, and these clinical signs are more severe in complete obstruction in comparison to partial obstruction. Common clinical signs are dry muzzle, dehydration, sunken and anemic eye, salivation, rough coat, turgid skin, suspended rumination, passes, dry or mucus coated dung ball, partial obstruction. In case of the partial obstruction, there is the patients are doubled blood rinsed urine, long painful attempts at urination, prolonged urination time, sustained urinating posture, urinary crystals are deposited at the prepucial hairs, bladder is palpated at this location. In case of the complete obstruction, there is no passing of the urine, strain to urinate, tail twitching, wet, shifting, sign of the abdominal pain. Sign of the abdominal pain are more severe in complete obstruction in comparison to partial obstruction. These signs of the abdominal pain are kicking at abdomen, flank, grazing, stretching out of all limbs, frequent sitting down and standing up, rolling on the ground. Urinary bladder is palpated at the initial stage. If these type of the cases are not treated on time, then bladder or urethra may rupture. In case of the rupture of the urethra, there is subcutaneous accumulation of the urine. This one, there is subcutaneous accumulation of the urine. In case of the rupture of the urethra, ventral pitting edema and sulfing of the skin in long-standing cases are observed. While in case of the rupture of the urinary bladder, rupture of the urinary bladder is known as cystorrhaphy. In case of the cystorrhaphy, 72 hours of the return urine. After that, at this time, urinary bladder is ruptured. Bilateral distension of the abdomen. This is bilateral distension of the abdomen seen in case of the rupture of the urinary bladder. There is water belly appearance, uroperitoneum. If these type of the cases are not treated, animals may die in 4 to 5 days. Abdominocentesis is performed using 16 or 18 gauge needle to rule out the cystorrhaphy. If the urine comes out on the abdominocentesis, that confirm the rupture of the urinary bladder. Rupture of urinary bladder is confirmed. Diagnosis. Diagnosis is based on the history and clinical examination. Palpation of the urinary bladder to feel the distended bladder or collapse. In case of the rupture of the urinary bladder, fluid is obtained by the abdominocentesis. Blood examinations are helpful. In case of the blood examination, there is increase in blood urea nitrogen and serum creatinine level. Radiographic examinations is helpful to find the calculi or site of the obstruction. Ultrasound examinations is helpful to diagnose the obstructive urolithiasis. When we perform the ultrasound, If the bladder is intact and distended with the urine, that also indicate there is obstruction of the urine, and there is increase the thickness of the wall of the urinary bladder, that indicate cystitis. In case of the rupture of the urinary bladder rupture, when there is rupture of the urinary bladder on the dorsal wall or subserous rupture, in that case the urine is present inside the urinary bladder and some part is present in the abdominal cavity, that indicate uroperitoneum. Treatments: the several options are available to treat the obstructive urolithiasis, but in this lecture we will discuss about two important options. First is amputation of urethral process. Second one is tube cystotomy. The maximum incidence of the urolithiasis in bugs is on the urethral process. So first the urethral process amputation is performed. To perform the amputation of the urethral process, first the extrusion of the penis is performed. To perform the extrusion of the penis, first give the camlofin, that is trade name is anaphotone, that is available in 25 mg per ml. 1 to 2 ml intramuscular is sufficient. After that, give the lumbosacral epidural anesthesia, perform using the 2% lignocaine hydrochloride solution at the dose rate of 1 ml per 7 kg body weight. This one is the anaphotone and this one is lignocaine hydrochloride solution. After the lumbosacral epidural anesthesia, restrain the buck in dorsal recumbency. Hind legs should be pulled cranially, hold the penis at the base and push the prepuce. The tip of the glans and urethral process is identified and amputation of the urethral process is performed, and massaging of the penis is helpful to relieve the calculi, and after that normal urination is started. Prepucetomy is advised where the exteriorization of the penis is not possible in immature animal. First palpate the tip of the penis, then small ventral midline skin over it. The penis is freed from subcutaneous fascia and gently pulled out. Urethral process is amputated from its base and massage the tip of the penis to relieve the calculi. If the normal urination is not started after amputation of the urethral process, we should go for tube cystotomy. So the second procedure is tube cystotomy. Tube cystotomy is urinary diversion tactic using the Foley's catheter. This is the Foley's catheter. This one is the stylet. The Foley's catheter have two ends. One is bladder opening end, other is the port end. Here two port are available in two ways Foley's catheter. This is the two-way Foley's catheter. in these two port are available, one for the balloon port, this one is the balloon port, and this one is urine drainage port. On the urine drainage port, the size of the catheter is printed. This one is the 18 FG or 6 mm in size, while the balloon port contains a color bands. On this color band, the amount of the fluid recommended to inflate the balloon is printed. And this one is the stylet that is helpful to pierce the urinary bladders and place the catheter inside the urinary bladder. Police catheter. Police catheter 12 to 18 French gauge Foley's catheter are recommended for tube cystotomy in birth. Size in mm, we can calculate the size in mm, that is French gauge divided by 3. If suppose the French gauge size is 12, means 12 number catheter, then this can be divided by 3. The size is 4 in mm. 12 is size in the French scale. The balloon port of the Foley's catheter have a color band on which the amount of the fluid is printed. The color of that band is indicate the size. The color band present on the balloon port is indicate the size of the catheter. If that is green in color, size is 6 in millimeter to mm. If that one is blue color, the size is 8 French gauge, and in mm 2.7 mm. If the color is black, size number is 10, size in mm 3.3 millimeter. Likewise, white, green, orange, red, yellow, purple, blue, and black. These are the color bands present on the balloon port of the catheter that indicate the size of the catheter. Anesthesia. 2% lignocaine hydrochlorides is used as lumbosacral epidural anesthesia. Restraint in right lateral recumbency. Lateral to penis on the left side of the abdomen near to the rudimentary teat is shaved and prepared for the aseptic surgery. Perimedian incision on the left side, cranial to rudimentary teat is given. Operative procedure anterior to rudimentary teat. This is rudimentary teat, and this is the site of the incision. To perform the laparotomy, incision is given on the skin, then fascia, muscles, and peritoneum is incised and perform the laparotomy. Reach into the abdominal cavity and bladder is located. In case of complete distended bladder, bladder is present just below the incision. In case of the rupture of the urinary bladder, we should locate the urinary bladder. A subcutaneous tunnel is made cranially to the incision to pass the Foley's catheter. Then with help of the stylet, the catheter is directly pierced into the urinary bladder. Normal saline is infused into the catheter to fix into the bladder. Then the peritoneum, muscles and skin are closed routinely. What is routine? First, the peritoneum plus muscles is sutured in first layer by simple continuous suture pattern. Using the number 1. In second layer, muscles. In third layer, subcuticular suture. Subcuticular suture are using vehicle number 1. Then on the skin, using nylon or silk. The free end of the Foley's catheter is sutured with the skin like this. In case of the rupture of the urinary bladder, first perform the cystorrhaphy, means repair the urinary bladder. Then, after the cystorrhaphy, perform the cystotomy. This is subserous rupture of the urinary bladder. Post-operative management. Antibiotic and analgesic administered intramuscularly for 5 days. Norfloxacin at the dose rate of the 5 mg per kg body weight. BID daily for 10 days. Ammonium chloride at the dose rate of 0.25 to 0.5 gram per kg body weight. BID daily orally until urine starts. Owner should advise to clamp or block the catheter 2 to 3 hours after 7 days to check the status of normal urination. Foley's catheter should be removed after complete dissolution of the calculi and normal urination start. Provide access, clean, fresh water, correct predisposing factors, Kulthi, Dolichos, biflorous, decoction orally for once a 2 months, salt supplementation, promote the water intake at the rate of the 4% of the ration. Ammonium chloride to reduce the urine pH at 7 to 10 gram per goat per day for 30 kg goat. Molasses avoid as its high potassium contents may diminish the acidifying effect of the ammonium chloride. Feed good quality hay should be provided and decrease the grain. Discourage the castration at early age. Water intake may be the single most important factors in prevention of the urolithiasis. Encourage the water consumption by providing the clean and fresh water. Temperature of the water should be normal, not too cold or hot. Salt or mineral blocks provided and regular exercise. Now this is the question time. On the basis of today's lecture, we design some questions for you. You are requested to solve these questions. At the end of video, the answers of these questions are also provided. Question number 1. Most common site of obstructive urolithiasis in bug is option A, urethral process, option B, ureter, option C, sigmoid flexure, option D, neck of bladder. Question number 2. Water belly appearance is observed in rupture of urethra, rupture of urinary bladder, rupture of uterus, option D, rupture of sigmoid flexure. Question 3. Cystitis is usually accompanied by option A, urethritis, option B, ureteritis, option C, nephritis, option D, urolithiasis. Question number 4. pH of urine of healthy goat is option A, acidic, option B, alkaline, option C, neutral, option D, none of above. Question 5. In goats, the incidence of obstructive urolithiasis is higher in option A, intact male, option B, intact female, option C, castrated male, option D, castrated female. Now this is answer time. You are requested to check your answer. Question number 1, answer option A. Question number 2, option B. Question number 3, option D. Question number 4, option B. Question number 5, option C. Thank you for watching this video. If you have any doubt, you are requested to write me in comments box. I will reply. You are again requested to like, comments, share and subscribe my video. Thank you.